Hello everyone. Today we're going to be talking about understanding OCD. So basically, OCD is obsessive compulsive disorder, which is a common long-lasting disorder where a person experiences uncontrollable recurring thoughts or behaviors that may make them feel the urge to repeat over and over. Some key insights are most people have occasional obsessive thoughts or compulsive behaviors, but in OCD, this cycle is so extreme that it consumes a significant amount of time. It can also cause intense distress and it might get in the way of important activities or responsibilities. By the way, OCD affects millions of people worldwide and typically begins in early adulthood. Understanding obsessions. So before we get into actual OCD stuff, we need to understand what obsessions are. Well, first of all, obsessions are repeated thoughts, urges, or mental images that are intrusive, unwanted, and cause significant anxiety or distress. Some characteristics of them are that they are typically unwanted and disturbing to the individual. The person often recognizes these thoughts are unreasonable, but cannot stop them for logic or reasoning. They usually intrude when the person is trying to focus on other things. Some common themes are fear of contamination or dirt, doubting and having a hard time dealing with uncertainty, needing things to be orderly, balanced, or symmetrical, aggressive or horrific thoughts about losing control and harming oneself or others, unwanted thoughts involving sexual or religious subjects. Understanding compulsions. Another important part before we get to OCD talk is what are compulsions and how can they affect you? Well, compulsions are repetitive behavior or mental acts that an individual feels driven to perform in response to obsession. The purposes of these actions are aimed at reducing anxiety or preventing a feared outcome, but they are either excessive or not realistically connected to the fear they are meant to address. Some characteristics are that compulsions provide only temporary relief, the obsessions and anxiety will soon to return. The individual usually does not want to perform these behaviors and does not derive pleasure from them. Some common examples are excessive cleaning and hand washing, repeatedly checking locks, the stove, or other security measures, counting, ordering, and arranging items in a specific way, repeatedly asking for reassurance from others, performing mental rituals such as silently repeating words or neutralizing thoughts. So now that we know some important parts about OCD, I want to talk about its cycle. So OCD operates in a continuous cycle. First comes obsession, then anxiety or distress. After that, compulsion, then temporary relief, then repeat the whole thing again. So what are some causes and risks? The exact cause of OCD is not fully understood yet, but it is believed to be a combination of factors. Some factors are genetics, brain structure and function, and environment. Now we're going to talk about diagnosis and treatment. A diagnosis is a healthcare professional such as a GP or a mental health specialist, which typically diagnose OCD based on a detailed history of symptoms and presentation. Treatment. While there is no cure, effective treatments are always available to manage symptoms and improve quality of life. Treatments are most successful when it combines their psychotherapy and medication. So if you're living with OCD, you should find outlet. With proper treatment, people with OCD can experience significant improvement in symptoms and lead full, productive lives. Something else is finding support. You are never alone. Don't let your stigma prevent you from seeking effective care. For more information and support, consider reaching out to the International OCD Foundation or checking out resources from National Institute of Mental Health. Thank you for watching. Hope you guys enjoyed.